From News 8, this is Live Desk Conversations with digital anchor Luke Laster.
All right, ladies and gentlemen, if you're joining us now, thank you. This is another Live Desk Conversations here at the Wood TV Live Desk. My name is Luke Laster. Today I am joined with Grand Rapids Public School Executive Director of Communications, John Helmholdt. John, how are you today?
I'm doing well, Luke. Thanks for having me on.
Absolutely. So what we're going to be doing here is asking John a few questions about pretty much the state of COVID-19 with the largest public school district here on the west side of the state. I do want to remind you there, as you can see on your screen, you see that hashtag. It says hashtag Hey Luke. If you have any questions for John, use that hashtag and I will be able to see your comment and maybe put it up on the screen and ask John as we get rolling here. So I do want to start off with the extension of this epidemic order. Obviously, this is fresh news. This just happened yesterday where it was extended there on Monday. Where does GRPS stand with continuing their virtual learning until we get a little more clarification, I guess, as that December 20th rolls around, which
That's right.
Who knows what will happen from there.
That's right. I mean, as you know, and as I think every one of your viewers know, that this has just been an ever-changing situation, and we've been continuing to seek guidance from our state and county health departments. The new epidemic order really doesn't change anything. We are currently 100% virtual, but we are continuing to plan for implementation of our return to learn plan, where we would transition into a hybrid in-person for those families who select it, and we'd still offer 100% virtual for those families that prefer that option versus the hybrid in-person. So the start date on that is still January 4th. However, I want to say that is subject to change. This new statewide epidemic order expires December 20th. We're looking to see what comes then. But we also know the Kent County Health Department recently issued a health warning that's advising all high schools to be virtual for the first 15 days in January. That would allow for that kind of quarantine so that anything related to New Year's, the holidays, some of that could phase out over that time. And so right now we are reviewing the latest epidemic order. We're in consultation with the Kent County Health Department. The Kent County Health Department has a new guidance or a framework for K-12 schools that does a risk assessment that basically says, even in the highest risk category, which is what we're in right now, students can be in person pre-K through 8th grade. That is new guidance. And in fact, in October, there was a guidance that came out from the health department that actually advised that schools be virtual 100%. And so we've been really following health experts, but want to make it clear, our goal is to get our students back at minimum hybrid in-person after the first of the year, whether that's on January 4th or if there needs to be a little window of opportunity based on what the health department is advising, we will look at that. But we are really committed to ensuring that our students and families have access to hybrid in-person pre-K through 12 or pre-K through 8, whatever we are being advised at the time.
So that sounds like, that's exactly what the MDHHS director was saying yesterday as well. Their priority is getting students back into school to some extent. So speaking about that virtual learning and that hybrid plan, how has virtual learning been going so far? And then how do you plan to kind of integrate that hybrid learning with the parents' choice?
Sure, of course. It's mixed results. I'll keep it real. We looked at the MAP test. We administered the MAP test virtually here in October, and the results were actually somewhat encouraging. You had 56% increase their national ranking in reading, and 59% increase their ranking in reading, while 56% increase their in math. And all grades saw some level of increase across the grade level. However, there was a large percentage of students, particularly high needs, high poverty students, who just didn't take the test. And as I think you may have seen in the news recently, we had an enrollment decline of 833 students. And so we have had challenges with attendance, even though we're seeing on average, it's upwards of 85 to 88% student attendance during synchronous learning, but it varies by schools. And so I think we would say, it's going as good as it possibly can. There's always room for improvement. We've made adjustments along the way, but the reality is we know what's best for kids is to get them back in person in some way, shape, or form, and that's what we are driving for.
And that is January 4th. So it's nice to be able to be transparent to parents. What happens now? I mean, it's hard to make estimations. It's been hard to make estimations about anything all year. But moving forward with that, if that doesn't happen, how hard will GRPS be pushing to make something like that happen? Even if it's only at maybe 25% hybrid or something along those lines.
That's right. At this point, we are really committed to implementing our return to learn plan in some way, shape, or form. The hybrid in-person would be, for those students, would be 2 days, and cohort A would be Monday and Tuesday all day long, in person, in school. Cohort B is Thursday and Friday, and then Wednesday would be asynchronous. Those days when they're not in person is going to be asynchronous learning. In some schools, particularly at the secondary level, we will have simultaneous, where thanks to some really cool technology, the teacher who's instructing in person will also be broadcasting live to the students who are virtual learning. And it's highly intuitive. It tracks students and who's speaking. We did it recently with our Grand Rapids Board of Education retreat and had a chance to kind of experience it firsthand. So we're encouraged. We're ready. We were ready back in October 26th, and we're even more ready now. Today, our parents are going to be receiving a communication with a new parent handbook that we've created specifically for COVID that includes everything about what to do if a student tests positive, what our mask accommodations are, the new data dashboard that is now on our website, where we've taken the metrics as outlined by the Kent County Health Department in their framework for K-12 and aligned it. So that data is going to be updated weekly. Parents, staff, anyone who wants to kind of see where we're at, they just go to our website under the coronavirus resource page, and the dashboard's right there. So we're geared up and ready, and even if there may need to be some delay from the January 4, or maybe there needs to be a grade level shift where we transition from lower grades to middle grades to high school, we're committed to getting back in person in some way, shape, or form.
And I do have one question. This one was asked overnight. I do want to thank Shelly for sending me this email. This one, you've mentioned essentially what I would think are the answers to this question, just over kind of a longer description, but I'll ask it here explicitly. Sure. This is from Shelly. Says, I have been involved in a homework help club at a local church this past fall, so I am familiar with the virtual learning offered to elementary and middle school students. I do not feel the students are being offered the same quality of education that they would receive if they were in person. Why is GRPS still choosing to only offer virtual learning when the CDC, MDHHS, and Dr. Fauci all recommend that elementary and middle school students attend in-person school? A lot of layers to that one, but
yeah, it is. And Shelly, thank you for asking that question. And you're spot on. I think we've done a very a good job with virtual learning. My son is in 7th grade at the museum school. He's doing all right. We've had to help him navigate a few things, but nothing is better than the in-person learning for multiple reasons, for not just the academic, but the social, emotional, mental health, all of that. But I think it's really important to know that Dr. Fauci and some of these most recent guidance is new. They were not advising that in person during the highest risk category. Even back just before October 26th, that Kent County Health Department bulletin included specific language that the Michigan Association of Health Professionals are advising schools be 100% virtual. And so it has been an ever-changing, moving target. I think we are very appreciative of our friends at the Kent County Health Department who came up with this framework. We've been saying we need to know what's safe and what isn't. We need a little bit more deeper dive into what we can do, because we want to get our kids back in person. And we know other districts around us have been doing it. There's a lot of other X factors that go into. We're a densely populated urban population center. And so there are other X factors that play into it. But that latest guidance is relatively new, and it is informing and driving our decisions. We are going to push through to get our kids back in person, hybrid, or some form as soon as possible.
You know, you just mentioned it very briefly there about mental health in these young kids. What, you know, these could have lasting effects to some extent, just the way that this year has been, and this everything that's kind of thrown at them for how young they are. What is GRPS doing to combat that or to help?
Sure. It's all hands on deck. I know that our social workers, our counselors, our therapists, they're and special ed specialists, they're working around the clock. They're reaching out to the students. They're doing virtual meetings. We're doing everything we can virtually right now, but we also know that once we get back in person, we've got work to do, not just on the social emotional side, but we also have to target our most at-risk students, those who've had very little attendance, who have been slipping. And we talk about the summer learning loss. We'll take that and multiply it by 3. And that's real national research that we know the highest poverty, highest need kids are impacted the most. And so we, as not just a district, but as an entire community, need to wrap our arms around these students and help them, support them, get them caught up in every form from academic, social, and emotional standpoint. It's going to be a big lift. And it's not just the responsibility of Grand Rapids Public Schools. I mean, this is a community responsibility that we're all going to need to play a role in. I know Shelley mentioned kind of her church group doing the tutoring. We recently met with pastors and are in fact surveying our pastors to find out what more churches can do. We met with the Boys and Girls Club and New City Kids, who I'm going to give a shout out because those 2 organizations, along with Baxter Community, Granville Avenue Arts and Humanities, they've been doing that outreach and support for students, whether it's tutoring, mentoring, extra help and support, or just a warm, safe place for them to go and do their online learning. They're helping to advise churches and others what more could be done. And so it's gonna be a community effort. It takes a village to get this done, and that we need the village now more than ever.
And so I also do want to take a moment to mention, John, thank you for answering those so far. Before we transition to kind of the next topic of this, I do want to say again to those who are viewing, if you have any questions or comments you'd like to make, use that hashtag that you see below my name there, hashtag HeyLuke, and put your comment up. I'll be able to see it, and if relevant and appropriate to the conversation, I'll be able to put it up on the screen, and John may be able to answer it for you. Again, this is a live desk conversation here from the Wood TV live desk. John Helmholdt from the Grand Rapids Public School District. So let's move on to the next topic of discussion. This also rather new here, are vaccinations. This is arguably one of the biggest questions when it comes to returning to education in full force there. How does GRPS, make those decisions to enforce or not enforce the shots? Just what are the discussions surrounding that?
Yeah, so I participated this morning. Dr. J from the Michigan Department of Health and Human Services hosted a webinar to kind of outline the state's vaccination plans. Right now, it's a little premature for me to really answer what are we going to do with students and staff around vaccinations. We are going to wait for guidance from the state and county health officials. We will address that when it comes. What we do know is that the state is prioritizing adults. And we also know that essential workers will be among those first to receive vaccinations. And that includes those teachers and educational support staff. And so we are eager to learn more about this. It's something that I think you're going to see a lot more information rolling out. The state, of course, is prioritizing, if I pull up my notes here, healthcare professionals, long-term care facility residents will get the vaccinations first. Phase 1B is essential workers. That's where our educators come in. And then the phase 1C is the individuals who are 65 years and older and individuals with chronic health conditions. Their goal is to have 70% of adults vaccinated by the end of 2021. That was in the PowerPoint slide that I watched today. So I think I'd say stay tuned. There will be more information, but the state has an active plan for rolling out vaccinations. I know right now, one of the things that we're in active conversation with Kent County Health Department is on testings, because one of the things that we need especially once we get back in person, is we need rapid testing. We know some of the surrounding districts like Forest Hills and others, they had a number of positive or close contact cases and lack of substitute teachers led to them having to shut down and go back virtual. And so if we can rapid test, that's going to give us a little bit of a leg up so that we can keep in-person learning going. I think that's the concern, is it's the yo-yo effect, is we bring them back in person, 10 days later, there's a close contact, there's a positive case, we have to shut down for 10 to 14 days. And so I think this rapid testing is something that will be a benefit. We're looking at a couple locations in the city of Grand Rapids that has not been finalized yet. A lot more details to be worked out, but I just want to kind of give the assurance to your viewers that we're deep in this, working side by side with the Kent County Health Department. And I just want to give a shout out, our friends at the Kent County Health Department, Dr. Adam London, Dr. Narali Bora, Joanne Hoganson, they're rock stars. This community owes them a debt of gratitude, and it's been our honor and privilege working alongside them during this very uncertain time.
You know, I think along the lines of that rapid testing comes the discussion of what has to change. You know, it was a good transition there. When students are welcome back, even if it is in this hybrid extent, what will be changing? You mentioned, you know, the need for testing, but what will be changing in the hallways of schools within the district?
Yep. It's we'll be 50% capacity, so that's why we're splitting it. It's a hybrid in person, 50% on Monday and Tuesday, 50% on Thursday and Friday. All the social distancing measures will be in place. We will have cleaning equipment, sanitizer, all the preparations that I think most of us have experienced when you go shopping or you go into a retail. Everything we need to do will be in place to ensure the safety of our students and our staff. We will be limiting visitors. We will be looking at how we do the social distancing in the hallways. If there's a passing of classes, we're going to try to limit the amount of classes that are changing. We're going to stagger the lunch hours. We're going to do everything possible to keep that social distancing. Masks are required for all students, all staff. And as much as we all know that is not a fun thing to be wearing a mask all day for 6 hours straight, it's about the safety and well-being of our students and staff. So we're going to mandate and require it.
So is there anything else, you know, that you would like parents to know? I guess at this time, we're very much living day by day, and now we're pretty much until December 20th when other decisions can be made, or for, you know, GRPS, that January 4th deadline, or not deadline, but where you could implement the hybrid learning.
Yep.
And so, you know, anything else that you'd like to mention?
Yeah, a couple things. Number one, update your contact information. Things are ever changing, and we send multiple communications out via email, robocall, text message, social media, website, direct mail, and we need the most updated contact information. So parents should contact the schools, make sure that they're opting in to receive these communications, because we legally can't send those communications unless they actively opt in. And we do have emergency capabilities, so we can always override on occasion, but getting that updated contact information, studying the parent handbook. We really want our stakeholders to know what the expectations are, particularly for the daily student health screener. The students and parents need to complete a daily screener before they come into school when they're in person. So, you know, for those kids that are in cohort A, Sunday night, Monday morning, and Monday night, they will be getting a communication with the screener, and it takes literally less than a minute to complete the screener. But if a student has any one of the symptoms, we are advising that they stay home. That's something that if parents are diligent, we need to make sure that a student, if they do come to school and they have symptoms, we are prepared to manage that. The teachers and the nurses know what to do. But again, by studying that handbook, parents will have a better idea of kind of what we're doing in preparation, what are expectations for parents and students. And they'll also be able to study what the data dashboard looks like and what the Kent County Health Department is advising as to what is safe for in-person learning. And it's a solid document, and it certainly supports our decision to push forward with hybrid in-person at minimum.
So on that info, finding that info, where's the best place to update your contact information, and where can you find the handbook to give it a read?
Best place for updating contact information is to contact the school directly. The head secretary will work through that, or the principal. And then the parent handbook is up on it's going to be up later today. We're just getting ready to send the communication out, but it's going to be at grps.org/coronavirus. And if you go just grps.org, there's a big yellow icon that says coronavirus resources. You click that, the data dashboard, parent handbook, frequently asked questions, all of that. There's some really good information that's on that website that's easily accessible.
And so we do actually have one question in here real quick that I think is another big point that we should hit on. I'm going to publish it. This is from Tanika. This is, what about special needs kids? What steps is GRPS taking for special needs children?
Sure. I mean, it's full tilt services to support our students with special needs. The IEPs have continued. The additional supports that we need to provide our students with special needs are continuing. They're mostly virtually, but we do have some of the printed and mailed packets that are going to be that have been sent home to support students. And then, of course, once we're back in person hybrid, we will continue to provide those services, and then also look at what additional services that we may need to provide to really help catch students up and keep them on track.
Gotcha. All right, Tanika, thank you for that question. John, thank you for answering that. I'm going to unpublish that one there. So I think we are going to wrap up here in just a few minutes. If anyone has any last minute questions or comments they'd like to make, again, that hashtag there is available to use. Just put that in the comment section and I'll be able to see it and maybe put it up on the screen. But one thing that I think that is important to end on is tell me something good. You know, we have some light on the horizon. End on a good note.
And on a good note, we have a dynamic new superintendent who, came to Grand Rapids and was ready to hit the ground running. And then, of course, COVID hit. And I just want the community to know that we have a strong leader who's working closely with the Grand Rapids Board of Education. The Grand Rapids Board of Education is united, and really collectively, we are committed to getting back to that in-person learning. And I think that's the real bright spot. Even for my own son, who's doing all right virtually, we're eager to see him back in school. And I think that is, if there's one really bright spot, is that is on the horizon. I think another bright spot, of course, are the vaccinations. We fully expect that the district will have some role alongside the Kent County Health Department, and we're really excited about that. The other is, it's almost the end of 2020. And remnants of 2020 are probably going to continue into 2021. I think we're all ready to check the box on this year. So that's certainly a bright spot for me at minimum.
All right. John, I appreciate your time. I'll just ask you to hang on the Zoom call here while I wrap it up real quick so I can chat with you afterwards. But ladies and gentlemen, thank you for watching this Live Desk Conversations. Again, John Helmholdt with GRPS, Executive Director of Communications. Hopefully you got all your questions answered. John, really, really appreciate the time. Thank you. And I'll chat with you here in a moment. Ladies and gentlemen, any other information that you might need, head over to woodtv.com. We'll have it up there for you. Have a great afternoon now. Have a great afternoon.